can appreciate gremlins. So welcome back. We had a little bit of audio difficulty and video difficulty, but we took a pause and we're back. What we have done so far is we have approved the minutes from April 8th. We approved the consent agenda. We had committee reports from the Mental Health Advisory Board, the County Board, which we'll probably discuss the contents of that a little bit later, and the Behavioral Health Policy and Funding Committee. And that was mostly we're getting ready for the upcoming funding cycle. And we have an action item later on in the agenda. So now we're going to move to, Hannah, did you have anything else you wanted to add? Okay. Now we're going to move to the Health Department Administrator's Report. So Jessica, take it away.
All right, so you guys have seen my report, and obviously there's been updates with the COVID-19 case numbers. We're at 127 as of today. Did you have any questions about what was in the packet? Hannah does.
Go ahead, Bob.
Hi, Jessica. Another great report. A couple and because of our format here, I'm just going to lay out a couple things and then you can respond to more informational. In the minutes, there was last time there was a public comment that was submitted, and I was wondering if there were any findings on that public comment, and I'm just going to go through these. Just want to really appreciate the HIPAA discussion we had in the minutes. And I thought that was one of the more robust conversations we've had. So I was very pleased with our discussion on that. I think it was thorough. This is actually referenced in Tom's message, but also I think it's probably more appropriate for you. Just want to hear, and I do have a follow-up for you, Tom, when we get to that point. That reference to the OAG requesting local health departments to collaborate on investigations. That gave me pause and concern about whether that was something that was within the scope of health department employees. So I was just wondering if there's been any more discussion on that and what that actually meant. But that did raise my eyebrows of if that's really the role of our staff, the health department staff, to be an extension of the AG.
And Tom, do you want to speak to that first, or do you want me to?
I'll just take the lead, and I'll do the cleanup.
All right.
Go ahead.
Oh, so Mr. Polis, to answer your question, there was question from statewide local health departments as to where the authority came for local health departments to work with the OAG. Initially in the gubernatorial executive order, this became a question also. And originally there were only 4 agencies listed as enforcement for the executive order. That was the Department of Public Health, State Police, Illinois Department of Financial and Professional Regulation, and the Illinois Gaming Commission. The Department of Public Health was the sole agency. Originally, they talked to the governor's office, said they did not have the resources to enforce the executive order statewide. But through their contractual agreements with local health departments, the Comprehensive Health Protection Grant, they can delegate that authority to local health departments. And that's where Department of Public Health and the governor's office feel that local health departments have the authority to act upon the executive order.
Thank you, Tom. Bob, did that answer your question?
So have our county specifically gone out to investigate? I know there was 60 some complaints or concerns, did we physically go out to investigate the site? I just feel like you could get in a scenario that you're almost into a policing situation. And ultimately, I'm leading this down to employee safety.
So most of the complaints have been coming regarding restaurants and how restaurants are operating. So we do have authority over the restaurants. We do license them for the protection of the community and staff. We have been taking the approach that the Department of Public Health recommended, and that was education at first. We pick up the phone, we inform the owner-operator that we received a complaint. We ask them how they're operating, and we give them suggestions. We had a lot of good cooperation from business operators using that approach. There's only been about 2 situations that I actively know of that we actually went out on site to see what they were doing. And I think that was mainly because the owner-operator wanted to get more recommendations from us to what they can incorporate in their operations to protect their staff and their customers. The approach that we're taking on resistant business owners, we have had a couple of resistant business owners, basically just to quote them saying, what are you gonna do? Some of them have liquor licenses. Another operation is their profession is licensed by the Illinois Department of Financial and Professional Regulation. If they don't want to abide by the executive order, then we will send a letter, carbon copy, to the Office of the Attorney General and the appropriate state licensing agencies. In one case, it's the Illinois Liquor Commission, and the other is the Illinois Department of Financial and Professional Regulation, and let them deal with the resistant owners.
Go ahead, Susan. Thank you, Tom.
Thank you. I had a question from a county board member on the reports that we get on the testing that we've had. They noticed that we have the cases broken out by ethnicity, and they were wondering if we are keeping track of those that are tested, because and if we can report on that. Apparently they've seen another county that has done that and saying, X number of people were white, X number of people were black that have been actually even tested, to make sure that we're we're getting to those populations that make sure that we can cover everyone. So that was a question that I got from a county board member. If we have those statistics, if we could put those out, please.
Okay, and I can look into our capabilities to break down that data. By that, we are right now receiving all of our testing data. It's combined, the PCR testing, the diagnostic testing that's done, similar to out at the testing site, with also antibody testing. So it might be that we're all testing combined. That's the data that's easiest for us to present, but I will definitely check into that.
Thank you, Susan. Hannah? Go ahead.
Thank you. Couple questions, and it I think goes back a little bit to Bob's question. I noticed that in the materials that we are not doing just the routine restaurant inspections right now, and I appreciate wanting to protect our staff. And I think it was particularly noted during the 2 weeks where there was the expected peak. But I'm also, I guess, somewhat concerned because I know that we have these places operating. One, I didn't know if there were special provisions in place for restaurants now with regard to staff wearing masks, gloves, et cetera, while they're preparing food or dealing with the public. And just, I don't know how long we can go without those inspections. And so it's just more of a question or thought at this point. How we can do that safely for our staff. Don't want to put anybody at risk, but I'm also concerned about restaurants operating without our oversight. And the second question I had was budget. Probably can't do it now, but I'm curious to see how our budget's looking. Are we seeing a lot more overtime hours? Are we spending less money in some areas? So maybe for our next month's meeting, I'd be interested in seeing a budget report that shows kind of any overages and underages of expenditures related to this. And that's it.
Yes, I'll talk to the budget first. End of first quarter looked good. And, we'll know more in the next month or two after second quarter, really the effects of COVID. But, overall things right at that moment looked good. And then, Tom, I don't know if you want to speak to the restaurants. I know, again, we're working on planning for going forward, but if you want to speak about where we are now and in some of your plans.
Yes, so yesterday I brought to the administrative staff meeting a proposal on going back into restaurants and beginning food inspections. We're looking at an indicator of entering into level 3 phase for the safety of not only for the staff but also for the public, because any one of my staff going into a restaurant could be an asymptomatic carrier. We don't want to introduce the virus into a restaurant that doesn't have the virus present. What is very important, though, is to understand that the virus cannot be transmitted through food or food packaging. The CDC and FDA have noted this numerous times. So the food handling process in the midst of COVID-19 is really no different than any other pathogen that the restaurant would have to be worried about. Actually, it's a lesser threat, because the SARS-CoV-2 virus cannot be transmitted through food and food packaging. So their daily operations protects them from passing the virus on through the food source. Now, the executive order states that an essential business can continue to operate without masking, provided that they can maintain social distancing. As long as the restaurants can work with their customers and maintain social distancing, they would not have to be masked. If their employees in the back kitchen are within 6 feet of each other, they have to develop a system to mask each other. If someone does become positive in that restaurant, they're excluded from the restaurant. The restaurant goes through a standard decontamination. Their standard sanitization process will generally take care of the virus if it's present. But we do recommend that they follow the Department of Public Health guidelines in the event that they know that the virus may have been present within their establishment. There was another part of your question, Hannah. I forgot where that was. Oh, I'm sorry, the inspection process. So we talked to the administrative staff. What we're proposing to do with the restaurants, our high-risk establishments are our biggest concern. Those high-risk establishments can and do serve high-risk populations. And we want to give them, the owners, operators of those high-risk facilities, the option of scheduling a time for us to go in when they are not very busy, and they can get staff out of the kitchen and let us do our work, preferably in an early stage of their food preparation for the day, so that we know that overnight their mechanical refrigeration is not failing, they're handling the food properly first thing in the morning, and following basic hygiene practices. We want to do this before they get into phase 4, because during phase 4, our community likes to frequent food establishments. And if we try to go in during phase 4 when they can open up, even at a limited occupancy, they're going to be overwhelmed. And we're just going to be a hindrance to their operations and trying to maintain some order when they're allowed to reopen.
Thank you, Tom. Corey, did you have your hand up?
I just was interested in Jessica's thoughts about how being able to keep up with the contact tracing has been going, especially as we've had a few more cases just recently. And again, if you feel like everybody's able to meet that need in a timely fashion and able to find who you need to find.
Yeah, so right now, we're lucky as a health department that we have 6 staff members that are trained and have been doing contact tracing just, every day before COVID-19. So we've got staff that are trained in that and well-versed in it. And so we're doing well now, but we are planning for the potential to need more. And so we have identified at least 6 additional staff in the health department that can help out with that if needed. So we're working on getting them trained. And then the Illinois Department of Public Health is working on a program that will make additional contact tracers available regionally. So if the health department needed that, that would be available to us as well. So we're feeling very good about where we are now and planning ahead. And I want to get a document that really details that plan to where you guys can see what our needs are going to be and what we plan to do to meet those. So look forward to that.
Thank you very much.
Thank you, Jessica. Any other yes? You have to sign.
My question comes back to meat processing. My contacts in Champaign have said how concerned they are with meat processing operations over there, mostly for the people that are working there, because they are standing very close to each other. It's a very rapid process, and most of them have not been masked. I don't know if we have any operations in McLean County that process meat that way. Do we?
If it's the meat processing plant that I'm familiar with over in Champaign County, that is a large volume processing plant. We do have 3 processors in McLean County, but they're small processors.
Okay.
They don't do the volume. They don't have the production that the one in Champaign has.
Champaign does. Okay. Just big concern about that one over there. Yeah. Okay, thank you.
Thank you. Anyone else have questions? Okay, thank you very much, Jessica. We have 2 informational items, the CARES Act Provider Relief Funds and the Peoria Heart of Illinois proposal. And I will let Jessica cover both of those.
So the CARES Act was put on the agenda because we received an automatic deposit into our account for provider relief through the CARES Act. But since that was put on the agenda, I have found out that that was not intended to be put in our account. So you can just ignore that money is being sent to its correct owner. And then, so for the Peoria Heart of Illinois plan, Monica Hendrickson, the administrator at Peoria County Health Department, reached out to me about that they had developed this plan to break the region that we are in for Restore Illinois into a sub-region and present a plan to IDPH and then to the governor, just to break us down into a sub-region. And I'm presenting it just because, for our discussion, and I have a call tomorrow with all of the different county health department administrators in that sub-region as a chance to ask questions about this plan and what it means for us. And if you had a chance to read through it, I know I sent it very last minute, but it is very health department centric. And so my questions to Monica so far have been about, a lot of data information and how we're going to get that, who's going to be compiling it for our region. And also, just a lot about the responsibilities that the health department has in this plan.
It was an interesting read. Yes. Go ahead, Corey.
And Jessica, you may not feel like you want to get very deeply into this yet until you've had your conversation tomorrow, but are there any things that like are of great concern? I mean, what are the things that are like most significant to you as you look at the responsibilities it might add?
It's really the data management is the part that concerns me, and the enforcement. So it really left a lot up to the health departments to be enforcement for this plan. And, you know, there's parts of it that are more strict than Restore Illinois, but there's parts that are a little bit looser. So there's a lot of plans floating around in the state right now. And they all have good pieces and they all have pieces that could be worked on. So I know this was discussed at county board as well. And so, you know, we're not going to move forward with anything outside of what the county board is doing, but just from a health department stance, want to get some ideas and questions you guys might have about it as well.
Hannah? Go ahead, Hannah.
Okay, thank you. I did go through it and I guess questions, concerns. One is the metrics that they are using to determine whether you move from one phase to the other. Are those based on the state plan or are those unique to this plan?
Most of them are very similar to the Restore Illinois plan. I'm trying to remember what exactly was different. There's a few things that are different, but mainly, again, right now the state is compiling that data for the region. And so this would be more on us to be compiling that.
Well, one thing I noticed not a metric was anything about testing and contact tracing.
So
Really not part of those different 4 or 5 categories of, you know, measurement that they use. So I have not looked at the state, but everything I've heard emphasizes the need for testing and contact tracing to identify people who are sick and quarantined to be able to safely open. So I was surprised to not see any testing metric in there.
yeah, I
There
believe
was
the
people, the population who tested positive or negative, but there was not any metric for number of tests or et cetera that I saw. Maybe I missed it, but.
And that was one of my questions about it too, was the metric related to testing in this plan is that a community-based testing site be available within so many miles. And my question was, so many miles of what? Because obviously the plan was initially drafted for one county, but if you're going by a region, is this it being available within each of the counties or a certain point? I'm not quite sure. So that was one of my questions. And I know Restore Illinois, what I've seen about contact tracing was, I think it's phase 3 maybe, and to get into phase 4, you need to be able to follow up with contact tracing within 48 hours, I believe is what the metric is. But in terms of other metrics related to contact tracing, I don't think either plan has many, just other than robust contact tracing.
Yeah, I mean, I saw the reference to the testing sites, but it was in italics and it looked like it was optional. So it really wasn't being used to weight things. So I just was curious that it didn't have any numbers for that. And also, I mean, it seemed very strong and I agree that our area has a lot of hospital capacity. But if you take us out of those other regions, I mean, will those people end up in our hospitals anyway? I don't know what's left after you remove us from that 1, 2, or whatever it was, what their capacity is like, and ultimately whether we have to anticipate people coming to our region for care. Do you have any idea on that?
Not really. The sub-region is really cutting off more of the northern counties. And so really, even with Restore Illinois, we're likely to see people from our area go to maybe a different region of even Restore Illinois for hospitals. So like the Champaign area is not in either region for us in either plan, and there's the possibility of that. And really, again, we're going to see individuals from all the different regions in our hospitals as well.
So are we being asked as a board to, at some point, not tonight, obviously, authorize you or get on board to say we want to join with this plan? I mean, what are we being asked to do with this for future reference?
Well, and as a county, we would really be moving forward with this. And that's even moving forward with submitting it to IDPH and the governor. So we don't get to decide that we're going to go with this versus that. It's more so if the health department, the county, all of our other municipalities, if we're in agreement as a county, that we would support this being submitted for review is all we really have control over.
Okay. So Carla, is this something we would want to do next month for the Board of Health to weigh in formally on this?
We could. I think a lot of it's going to depend on what direction the county administration takes. And what Jessica finds out once she gets together with the other health departments and finds out a little more detail.
I guess I would like to ask that the Board of Health takes, make a statement through formal action to add to the voices for yay or nay.
Tonight,
Go ahead, Sonia.
you want to ask?
Yeah, go ahead.
I was gonna say, are you asking for that tonight or after we get more information?
I don't think we could do it tonight because it wasn't on the agenda early enough, so.
Yeah. Okay.
But I think just as it goes forward, I think it would be useful for the board to have a position, so.
Go ahead, Susan. I was just getting ready to call on you anyway.
One of the things last night is that I said that I wanted the Board of Health to weigh in on this, this whole thing. And I have questions of my own, but I also got questions from county board members about this. But, and then also I watched the press conference today that the Peoria area had with the mayor and the health department administrator and somebody else. And then there were a bunch of mayors on, that was on at 11 today. So I have a couple of things that I learned on that. My big concern or concerns that other county board members had posed to me, and if you read on some of this stuff, is that I mean, you said that we had 6 contact tracers and 6 more potential, but there's a lot of things in here where it's actually putting an awful lot of enforcement and authority into either you, Jessica, or the health department as a whole as an enforcement mechanism. And I mean, it's got pretty strong language in here. And I mean, it gives you authority to, allow the business to be fined or closed. And it's saying actually change ordinances and things like that on what kind of authority you have. But the big question on that, even when it comes to that, was, do you have enough capacity to even do some of these things? And number 2, do your employees feel comfortable being the enforcers? Like, we kind of was that little bit before what Tom was talking about, and the question that Bob had. But this is coming from other county board members to say, is this really where we want to go on that? And are they pushing, not necessarily this group, but as you can see, things kept getting pushed down on responsibilities from the national level to the state level, and now the state level is pushing it down to the local level to be the ones that actually do the hard work of making sure people are doing the right thing, whether it's, distancing or, only having 25% capacity or whatever. So there was concern from county board members about our abilities in general, about being able to do something like this. That's my first one. So I'll let you talk on that one first.
So, right now, we are following up on complaints, like Tom mentioned, for businesses. And, there's obviously that piece where if we can't get voluntary compliance, we can take it to the State Attorney's Office or the Office of Attorney General. And so my question is, if a new plan goes forward, is that still in place? And, in terms of capacity, if we were having to then, enforce for the general public, I don't know if we have that capacity or that, ability, willingness, and just ability, really. So yes, those are definitely my concerns with how health department centric it was, which is good for a public health plan, but not necessarily when you're talking about enforcement or education. And and contact tracing and prevention, that's our ballgame.
Right, and that was another item because of the local site being moved. That one of the things that the county board did yesterday, one of the members is going to, and I don't know if he's contacted you or somebody over there about trying to really get IDPH to not, I mean, I know they extended it a week, but to really, in order to actually do some of these things in this plan, you have to have that testing done, and our community doesn't really have that. And I think that that's kind of a misconception there. And so to step into something that we really can't do, that Peoria can do, because they've got 4 testing sites and we'll have 5 now in another week. So I think that there was some concern on the county board on that too. So that's another.
And if I could just follow up on Susan's point, I think there was lots of stuff in there about you providing guidance to businesses on how to safely operate. And I guess, so that's McLean County guidance as opposed to Peoria County guidance, as opposed to any other county. And it would seem to me that we need uniformity, if nothing else. And, obviously we have some great deal of expertise in this county, but I think we want to rely on a larger group of scientists and people who know to put forth some recommendations. So I definitely agree with Susan's comments. I think this put a whole lot of responsibility on our county and specifically the health department.
Lori, go ahead.
So is there going to be a group? So it sounds like, Jessica, the group you're talking with tomorrow are all Department of Public Health people. Is that correct?
Yes, all the local health department administrators.
Okay. So is there going to be a larger group convened that would bring in some additional players, stakeholders that might have a role to play here before this would go forward? I mean, I guess, Susan, I'm asking you as the county, is there a committee that's going to be put together at the county board level to look at this as well, so that it doesn't stay all in the hands of the health department and put that much on their shoulders? And I mean, because it sounds like this is going to go forward one way or another, but I guess we have the option of joining it or not joining it. Is that correct? But do we have all the right I guess my big question, do we have all the right players together to help make the best possible decision, including, as you said, Hannah, the scientists and the ones that really have the big long-term picture?
The meeting last night with exec was Chairman McIntyre wanted to get some kind of consensus as to whether or not the board wanted to. What this is basically sending a letter of support for this plan and to the governor and IDPH. And he wanted to get a consensus of the board members as to what they felt about it. And so whether or not that goes forward, I don't know, because that's Chairman's, getting some of that. There were only certain members of the committee that were there, but then he was going to make sure he was going to contact all of the county board members to see how they felt about it. So whether or not that goes forward, I don't know, and what shape. I do know that after watching the press conference today, the mayor of Peoria did say that even if the governor said no, they were going to move forward with this plan. And so there's a whole lot of then other ramifications that come along with that. Not just, if the governor says no, then is our health department going to have to then, even though we might be part of this group, does that then mean that an enforcement issues when restaurants can't be open, but this plan says we can be open? So are they going to go in there and enforce things? There's a whole lot of things like that. There's probably some legalities and liability issues that go along with those things too, that I am not a lawyer. And so, and actually the governor has said that they will take away people's licenses if counties do things like that. So I guess I'm not sure that I mean, there's things in this plan that I think are right, and so it's not that I'm against the plan. We just want to make sure that we're doing the right thing legally and professionally and that kind of thing, because it impacts everyone, and then it's economic impact also. So, so that's kind of where we're at on this. It's just maybe a letter of support, and then Jessica can ask, how are you going to do this? How are you going to address this issue? What are you going to do if this comes to, bear? There's monetary issues here too, not just businesses opening monetary issues. There's other monetary issues too, funding type issues. So that I think that we have to be very, very aware of if we're going to really jump on board with something that, we have to have a lot of those answers. And I think that that's what Chairman McIntyre was trying to get at, is to figure out which way he was going. And I know he has a meeting with the mayors tonight, so with the other rural mayors in McLean County, to get maybe more information from him. So that's why I said, I don't know where this is all going. Does that
Well, I
help
guess that was
you
my
a little bit?
question. My question is who is going to put together those questions so that all of the right things are considered before moving forward? And if we're going to weigh in on it, how are we going to be sure the right questions have been asked and answered? And so that's what I was wondering, is what's that going to look like to the vehicle that's going to get those, that's going to generate the questions and get the questions answered?
Carla?
Jessica, you want to take a stab? Hang on a second, Hannah, I saw you. Jessica, you want to take a stab at that, or Susan?
My stab would be, my questions are very health department, public health focused, and I'm sure that, the county boards are they're including public health, but also more of the, what it means for the county larger. So, my questions are a lot about the things that are indicated that the health department would do. What does that mean? And obviously questions about, Restore Illinois, what happens if the governor says no to this proposed plan, but Peoria moves forward? What does that mean for the rest of us in that region and in that sub-region? So that's a really good question.
And also questions about testing. Hannah, go ahead.
Yeah, I guess one of the things that I would like to say is, did Chairman McIntyre ask for the Board of Health to weigh in? I know I'm going to rankle some things here, but we are the Board of Health, and we are charged with setting policy for our health department. And I think it's really important for us to have an active role in this particular issue. And so we can just set, I don't know how we do it practically, whether we do it just by email chain, or I don't know the time frame, but I really think as a Board of Health, we should have a position, or at least a very detailed set of questions to ask.
Yes, I think the questions are very important.
or just to whoever else wants to get in this. I mean, we should be weighing in. I'm sorry, I'm getting a little like, "Ugh," but you know, I think we just should be a part of this discussion, and it starts with us. I mean, Jessica is, you know, we are her supervisors, and we need to support her in this and give her some direction as well.
That's true. And last night at the meeting, when it was brought up, the plan was brought up by Chairman McIntyre. One of the things I did say is that I am the representative from the county board to the health department and vice versa. And I said, and I really wanted the Board of Health to weigh in on this because of the role that the health department would be taking in that. So I was the one that really pushed it. And then I've talked to Chairman McIntyre today, and I will be talking to him probably tonight or early in the morning after this meeting, just so he knows where we've gone with this, or you know what our discussion entailed. But yes, it was very clear. I made it very clear that I thought the Board of Health needed to weigh in on this, and so that's why we're discussing it now, I guess.
Go ahead, Sonia. That is correct. That is why we're discussing it. Sonia, go ahead.
I would agree. Our charge is to look at the health issues. All of us have visions of other aspects of the community, including the economics and what is this doing to families and jobs and so on. So I'm not oblivious to that. And I assume that there are others that will be working on this, perhaps the Chamber of Commerce or the EDC or so on, is also going to look at the plan and share some perspectives from their view. But our unique role is to deal with health. And I appreciate an opportunity for us to express that, to understand the implications for it, and not step away and say, well, that's going to be somebody else's decision. We need our voice heard on it. And so at such point as you, Jessica, I'm talking with you now about what you're seeing and hearing from a standpoint of stability, an ability to change a little bit of the rules, to let some of these things happen with some degree of comfort, then you know, I'm going to appreciate hearing it. But I need to hear it from you, not from something I read on social media.
Okay.
Thank you.
So Jessica, after you meet with folks tomorrow, is it possible for you to send out a short summary?
Yes, definitely.
Would that work? Is that agreeable? Corey, I'm sorry, go ahead.
No, I think that would be very helpful, but I also wondered, I guess my question is kind of to Jessica Woods. I mean, are there legal questions that need to be posed by your office as well, that should be part of, you know, any decision we support or don't support?
Well, I mean, it's kind of a tricky situation, and it depends on, you know, if the governor's office is going to support it or not. If it's going rogue, whether the governor says okay or not, I have serious concerns about that. I won't say, I can't, you know, without studying it further, I can't say exactly what the repercussions could be. If it's simply just asking the governor if he would agree to allow us to do this, then, you know, with his consent, I don't see as many legal issues from that standpoint. Now, from the other standpoint of then the health department taking on the responsibility of monitoring the data and the metrics and moving forward with that, enforcing the requirements, there's more legal liability there. Is it a great amount? I don't know. I would have to look into it a little further and do more research, but there does add a layer of liability there. It may not be great, or it might be. I would have to look into it more before I could really advise you much further on that.
But I'm hoping that the group that's meeting tomorrow has an understanding of those issues. Although, I mean, ultimately, I think, again, as you're saying, that's very public health centric, but it does have liability issues for us as a health department, I would think, if something happens that, you know, there's something happens in a restaurant or any business that opens up and there's several cases that happen because of that. And we, you know, and then perhaps the issue is, did we not do what we should have done or whatever? So, I mean, I guess I just want to make sure that, again, the right questions are being brought to the table for consideration as this is being put into, you know, a formal proposal.
Go ahead, Hannah.
Yeah, and I just go back to my original point. This is a really important issue. And I would like to know what the collective feelings of the health department administrators are, but I think we as a board should decide. I mean, and I appreciate, Susan, very much what you said at exec, you know, the Board of Health should be involved in this or this, but I don't consider the discussion we're having today with a plan that we received with not much time to review and no criticism in saying that. I'm just saying the practical effect is, I don't know how many of us have read it. And, you know, I think that there needs to be some, I don't know whether we just say by a certain date or by next week, everybody read it, submit your comments to Carla, somehow to come up with some sort of response as a board to how we feel about it. You know, we're all just, it's such a strange time. We're all tired of being cooped up and really feel badly for the businesses that are being derailed during this time. But, you know, we also have to work, you know, logically and dealing with this issue. And, you know, and as you said, if Peoria says, well, we're just going to go ahead and implement this, well, that doesn't bind us, but does it? And if, you know, the city of Bloomington is saying, no, we're with Peoria, I mean, it's a big messy situation. And, you know, certainly I guess starting in the little piece, I just think that as a board, I'd like to think that we would, as a group, weigh in on the benefits. I mean, I think some of the things that were laid out in terms of stage 1, 2, or 3, or green, red, yellow, or whatever it was about how to operate businesses, all those guidelines are good. My concern really is on the metrics at the front end of how you determine whether you're ready to move forward into those. And without anything in there indicating a level of testing, I'm concerned that we can safely move forward. So, but that's it. I would like to think of a way that the board can either, maybe Susan, you can indicate to Chairman McIntyre that we will provide him with our opinion, or I don't know what he's intending to do as far as how he's moving forward with this. Is this something that would be put on the county board agenda this month?
Go ahead, Susan. Say yes.
That's unknown as to, because I don't know what he's all done yet. And that's not till next Tuesday, and lots of things can happen in a week. So yeah, I agree with you, Hannah, on that we have to figure out what we really want to do as a Board of Health. I mean, I have my Board of Health hat on. I don't know if that answered your question, but I think that he's taking all the input. And yes, like you said, Mayor Renner has, said, yeah, they're going to go with Peoria. So then we start getting a patchwork of all these different things. So if Bloomington or Normal or both, I don't know what Mayor Coos has done, if they've gone ahead and said they're with this in this plan, and then, but we as the Board of Health don't believe in that plan, and I'm just making this up, where does that leave us? I mean, if people are doing things that are against the governor's order, and moving forward with a plan that the governor doesn't condone, where does that leave us? And that's I think a concern. I think that's some of the legalities maybe too and the liabilities that Jessica was talking about. But I also have another question. I don't hope that answered your question, Hannah. But my question though also is that, and it comes to the metrics that Hannah was talking about and the testing, is that in that press conference today, they were talking about Sentinel, which I don't know what Sentinel is. And I think it's something to do with data. But she mentioned OSF was fine with it, but she did not mention Advocate. And what I wasn't clear on all this time we've done testing is that tests that are done in hospitals or in doctors' offices or whatnot aren't necessarily reported to IDPH, so that we don't necessarily get true numbers. I don't know if that's still correct, but I thought that was what it was at the beginning. So if Jessica, you could clarify that for me, please.
All right, I'll do my best to talk about syndromic data and Sentinel sites. So just from what I know from my previous life, so in flu, Sentinel sites throughout the US, and not every hospital is a Sentinel site, but they collect syndromic data. So like if I go to the hospital and I have flu-like symptoms, I may not be tested for the flu, but that data is collected that I have flu-like illness. So they have started collecting that. CDC has a report that comes out, I think, weekly, and it has COVID-like illness in it now. So that's syndromic data, is that you have this illness that is like COVID, but you may not have been tested for it. So it just gives a better picture of what's going on in our community with that illness without having all of the test data necessarily. So that's what syndromic data is. I don't know if Advocate is a Sentinel site, and so that may be why they're not included in that, but I can check into that.
So what about the results of tests that are done? I mean, I don't know if Dr. Ginsburg, if somebody came into your office that they wanted to be tested, where you send that to, other than, I know you're part of Advocate, but if you were in your own little private practice that really wasn't like called Advocate, whatever. And like I said, I thought at the beginning that those numbers weren't actually being included they were not being reported to IDPH, so that way we didn't know how many cases we really had. That was earlier in the process, and I don't know if any of that's changed, and I guess that's part of my question.
I'm not sure if, I mean, from what I understand from talking to the infection control nurse at Advocate at Broman, is that we coordinate everything with the health department. That, in other words, any positive that comes up gets reported to the health department. In fact, I had a question because we had a death about a month ago or so where it didn't show up on the McLean County Health Department site. And then I found out that it showed up on the Woodford County site because the patient actually lived in Woodford County, even though she died in McLean County. I know that over the past, actually just the past few days, I have started ordering patients have requested, and I have ordered a couple of antibody tests. The antibody tests are being done through a variety of offices. They are being done at OSF. They are being done at Advocate, and haven't had a positive one yet, but I'm sure that will be reported too if it comes back positive. When Advocate kind of came out with the antibody test for us, it was explained to us that they wanted to use the antibody tests to either identify patients for research purposes or identify patients who might be plasma donors in potential treatment trials. But so there's not a big push to run around and get antibody tests on everybody. As of, I believe, today or yesterday, Advocate and Broman, well, the entire Advocate system started testing every inpatient. Every inpatient is going to get a COVID test, whether they come in with COVID symptoms or not. Those are being run, as far as I know of, at the Advocate Lab, which is up in the Chicago area, which gives us back results in 24 hours. They have a limited number of the rapid tests where you can get back results very quickly, and we're still kind of debating or discussing who are the ones that primarily get those tests. Like, for example, if a patient comes in and they need emergency surgery or something like that, where they would need to have anesthesia put down a tube, they would get a rapid test. So there's a lot more testing available now than there has been, and they're broadening and broadening and broadening who's going to get tested. In our office, because I'm in a pulmonary office, we do pulmonary function testing, and we had closed down our pulmonary function testing for the last month and a half. And we had long discussions about what we were going to do about that, because when you do a pulmonary function test, essentially you're blowing into this machine as hard and as fast as you can. And from the standpoint of aerosol generation, that's about the highest amount of aerosol generation a person can generate. And so we finally are starting next week to open up our lab again, and every patient that has a pulmonary function test is going to have a COVID test beforehand. So, you know, the testing is definitely expanding. Are we at the point where everybody's symptoms or no symptoms is going to get tested or can get tested? I don't think so. And until you are that widespread, it's really difficult to know the answers to a lot of the questions that have come up here, because we don't have the metrics. We don't know how prevalent this infection has been in our community. We don't know about asymptomatic carriers. We don't know anything about that stuff. So any decision that's made about reopening is probably going to be made with less than ideal data from the federal government to the state government to the local governments. And all I can say, you know, I've been a big proponent of very slow and careful, and you know, assess each move you make after you make it. Take a couple of weeks at least to assess each move. I can tell you that, you know, we thought there was you know, from the health department data, we thought that there was a lull, or whatever you want to call it, that there was a plateau. And we were seeing at Broman, there was a period of time we had no patients. We had no COVID patients at Broman. And then it exploded again. And now, you know, there's more patients at Broman, and you know, we have the nursing home outbreak. And so it's, you know, they talk about first waves and second waves. I don't think any of that applies. I think we're all in one big wave, and it's just hitting every different part of the country a little differently. It depends on how dense your population is, and your response to opening up again should be made more locally, but no matter where you do it, it should be done slowly.
Go ahead, Corey.
Well, I have a couple of points. So Kathy CA, you are part of that emergency management team, right? And I forget how big that is. Does that go beyond McLean County, or is that just McLean County?
Well, we have, within the health department, there's the emergency preparedness program. And that's just one full-time program coordinator and a part-time office support specialist and the medical reserve corps. And we've currently.
But I'm talking about that group you meet with, the big team that you meet with. Yeah, is that just McLean County?
Yeah, McLean County Disaster Council, which
Okay.
hasn't met for a couple of months because of COVID.
Yeah.
So that's And some of the people on the McLean County Disaster Council are invited to the McLean County Emergency Operations Center, to the EOC. And those
Okay.
calls happen 3 times a week at 3 o'clock
Okay.
on Monday through Friday.
Yeah, and my point about that is I think there would be some voices on that group that might want to weigh in on this too, or that we should perhaps listen to as if we come up with a decision. So that was one point. The other point I'm wondering is, and I'm throwing this out for all of you to see if you think this is a good idea. We do now have that committee that is the policy and funding committee. And I wonder if it would be reasonable for that group to have all of your questions and perhaps questions from other stakeholders related to public health, but also the ripples of that be funneled to that committee, and that committee meet and help create a position paper or whatever that we then give to Chairman McIntyre and Susan. Because I just feel like if we just throw in random questions and there's no organization and discussion around this, we're not really doing our due diligence. So I would like to feel like it's been that we've gotten everybody's input, but then we've massaged that, digested that, and then put that together into a succinct position paper representing the whole board. And that I'm throwing that out, is that one possible way to do that?
Corey, it is the behavioral health policy. So, and I know we're all being driven.
I forgot that.
I mean, I think the idea is a good idea to
Perhaps we need another standing committee that's now related to that, because that has been a good mechanism. So perhaps we need a standing committee to look at this and digest it a little bit more than just random questions.
Yes, Sonia, go ahead.
I see two kinds of questions here. One is, do these 14 counties want to pull themselves away from the larger group? And I have the impression that that's because the statistics in the far northern area, the Rockford area, are much more dire than they are down here. And so looking to separate ourselves out, we may have a better metric about how we're doing. A second thing is, and I don't know the answer to this, is the way we're measuring it going to be different than if we were a part of the larger group? Jessica, maybe you know the answer. Are we creating a whole new set of measures that are not currently in place? Or are we just wanting to carve those into our 14 county area?
A little bit of both. So most of the metrics are the same. It's just that, yes, right now IDPH is compiling all of the data for those regions. And we have to then compile this on our own as a sub-region.
Okay, so they're going to look at the whole region. We're going to take the same kind of question, but focus on the 14 counties and say, how do we look different? Where are we in the progression to change, to opening up? Is that kind of the question? I mean, the scenario we have today? I'll repeat that. Or are we frozen?
No, you're not frozen. Go ahead, Jessica.
Well, so are you asking me?
Yeah, I think so. Yeah, you're the one with the best knowledge of what this plan is.
So what was the question?
Okay. In looking at the full picture and the metrics, or just the 14 counties and the same metrics, are we more aggressive in our schedule that we want to do in the 14 counties because we think we're better off here, that we're doing better? Is that the principal change, is we want to move at a 14-day clip instead of 28 days? What's the difference between the metrics of the full plan and the 14 county plan?
Yeah,
Or is that
would,
still,
I think it's still a little bit unknown because right now, according to both of these plans, if that 28 days was not there, we would be able to move to the next phase in both plans. But 28 days is in the Restore Illinois, and it's not in this other one. However, there are some things that are included in this plan that are not in Restore Illinois, and it's really this. Some of it is this. There's some metrics that are about. I'm trying about community engagement, where you're doing these surveys and assessments, and I'm not sure how that data is collected.
okay,
Okay, Bob, go ahead. Oh, sorry, Sonia.
no, that's okay. I'm
Did
just
that
trying-
answer your question?
Well, sort of. I think I was just trying to get my arms around whether it's a matter of geography or a different interpretation of what we measure. And maybe all of that's still kind of coming together.
Yeah, I think it's all coming together because there are
All
pieces,
coming together.
yeah, there are pieces that are geographical. But then I think there's also some things that are not.
And back to Hannah's point about taking a position, it's going to be hard to take a position until I think we were able to see how is this looking different than the plan we're currently under. Is it simply because of geography that we think there are higher situations up in Rockford and we don't want to be countered with that, or is it really different? And that's what I would like to see, how you're shaking this out with the new, with more detail around it. Thank you. I'll stop.
Thanks, Sonia. Bob, go ahead.
Yeah, I would like to propose that we close this conversation. And for the reason is that there's so much that I can speak for myself that I don't really understand of doing a side-by-side between the HOI and the state region. And so that's what I would need to make a decision, is to do a side-by-side of what the differences are. And also someone else mentioned that this is going to change so rapidly in another month. Who knows where we're going to be? And so timing wise, if we're actually going to do something, it's going to have to be done within a month. And so I would like to just conclude this with a consensus of what the steps are. And I think one step would be to have a summary from Jessica after her meeting tomorrow. And then from that, we're going to have some kind of interim meeting if we're actually going to contribute in a timely manner. Otherwise, in another month, these two plans might be merging together and this conversation's for naught. So right now, I don't think we can conclude anything. And I think we just said, okay, what are our steps, and then go forward, because I would have to do more research and understand a side by side. So I would like to move on after we conclude what our steps are going to be.
Go ahead, Susan.
Bob, if you Google Restore Illinois, there should be a document that's probably about 10 pages that you can use. It's not, none of the graphs are easily, or checklists or whatever you want to call it, easily comparable, but the wording in there and the different phases, if you look at one of the page in the one that Jessica sent us, page 2, where that has that little graph at the bottom, a little chart. And if you look at the Restore Illinois document, you can look and see what the different phases are and see where they overlap and things like that. So that might give you a better idea as to how they relate to each other.
That would be
That was just
fantastic.
informational.
I haven't done my homework on this to be able to converse to a level of detail that it requires. But I am concerned about the timing, that how rapidly this could go on. And we really would have to meet, have an interim meeting to respond in a timely manner.
I agree that there needs to be something set, and whether it's going to be the whole board or, like I mentioned, a standing committee that the whole board feeds into. If you think we can get everybody together for an interim, then that's a fine way to do it. But I think there has to be more than just people sending questions in. I think this is too deep for that, personally.
Yeah, no, I think I'm in favor of having an interim meeting, if that's possible to pull off. Hannah, go ahead.
Now, I was just going to make a motion that this matter be put on the agenda for the, and I realize timing is a factor, so this is without, that it be put on the agenda for our June board meeting. And that we ask Ms. Schaefer to ask Chairman McIntyre to refrain from taking any county board action until the Board of Health has an opportunity to review this and to render or provide him with a recommendation.
Okay, so we have a motion to,
At point of order, I don't think we can make a motion here because it's not an action item. I think you just need
It's
to
not
make sure
action
we have a
item, okay.
consensus. You just get a consensus.
Yeah, I mean, I understand the
Scott, go
timing.
ahead. Right, no, the timing is an issue. Scott, go ahead. Hang on, Jessica.
Have any other regions tried to split into sub-regions that you know of? Can you hear me?
Yeah, not that I know of in terms of subregions. I know there are some counties that are going separately, and I don't know. No one has had a plan approved through IDPH or the governor. So if there are counties or subregions that are going their own way, they're going their own way.
Can I
They're
interrupt
doing
here?
that-
I'm sorry, Scott.
They're doing that without the approval of the state. They're just going on their own.
Yes.
If
Some-
you
Some
want
folks have even been
to-
filing lawsuits. Go ahead. Sorry, Susan.
If you want, Madison County, yesterday, I think it's their Board of Health was actually members of the county board or the Board of Health. They did pass 26-2, very bipartisan, because it's like their county board is pretty split even on that. And they passed something, and I think Governor Pritzker addressed it in his press conference today. So if you want to do some research and Googling on that, it might give some clarity or some more information as to what other counties have done and what kind of response they've gotten. I think that there's another county in Southern Illinois that has also done something, and so, or try to move forward or whatever. So I think that there is some more research that can be done by us as Board of Health members to have a better understanding as to what else is happening within the state on how these are working. But I think this is the only one that's actually a region that's actually come up with an idea. Although I do know the Collar counties want to not be in Cook County's region because they are not as what you'd call bad and have as much, the cases aren't as high in the Collars than they are in Cook County. So they are also starting to ask some of these questions and trying to create their own plan or not want to be in that region because of that. Like, you know, Rockford is in our region. So I think that there's a lot of that going on. And so I don't know if that gives you more information, Scott, that, you know, but there is stuff going on like that.
Jessica, you were going to weigh in.
I was just going to agree that you can definitely take like a consensus on what your path forward, but it wouldn't be an official action item.
Right. Thank you. Corey.
I just had a question to ask Jessica McKnight, which is, do you feel like June, our next board meeting, which is actually in what, the second week in June, is that going to be problematic for you as you are working with the group you're meeting with tomorrow? Are they going to be willing to, I mean, are they expecting you to have a response from the McLean County Health Department sooner than that? I mean, we're talking easily a month, obviously.
Yeah, I mean, it's likely that they're wanting a response now, but again, there's more players than even just us involved. And my question is for them tomorrow is also going to be about what happens to us if, what's happening if we choose not to move forward with this, and they do, and even if it was accepted on the odd chance that it would be accepted, what then happens to us if we're not bought into that? Are we still in the Restore Illinois group? So lots of questions.
So my suggestion is, Jessica's going to meet with her group. I think we're probably going to have a special board meeting before June to kind of get ahead of this and discuss it one more time and make it an action item for whether we recommend this or not. I have some serious concerns about the amount of pressure that's going to be put on the health department from the business community. But I mean, we can't do anything about that. But I mean, this seems like and this is just based on what I've seen in the newspaper and on the TV, that there's a kind of a steamrolling effect going on that may overwhelm issues. Corey, I'm sorry, I'm not speaking well enough. Go ahead.
No, you are, exactly. And my point is, if we are going to meet to make a decision about a position, I want to make sure we've all looked at the same information. I appreciate Susan suggesting to look at this and look at that, and I have looked at some of that, but I feel like every one of us, if we're going to weigh in on it to create a position for the McLean County Health Department Board, we should all have looked at the same document. So I'm wondering if somebody who might prepare, a packet with the salient information in it for us to look at, so we are, all examining it from the right perspective.
I think I'd be willing to work with Jessica and Amy to get a packet together unless somebody else wants to do it. Since I can be a data geek sometimes.
And Carla,
Yeah.
can I, to me that from what I'm seeing is that I think, and to Sonia's question, is this just a matter of carving this out so that our metrics look better because we're taking the meat packing plants and other things out, but we're still following the same measures to make decisions about moving forward? And I think I heard Jessica say there was not uniformity there. So I guess going forward, what I would like to know is, are these measures, do we agree that these are good measures to use to make that decision? I mean, that's the first hurdle, right? These are the measures, the standards with the percentages up or down. And then the second is, there's a long list of, in phase one, different types of businesses and entities can do this. And so with this sort of, distancing or, numbers of people and whatever, and, I don't know how to judge whether those are reasonable or not. And I don't know whether, I looked at the Restore Illinois, I don't see the level of detail on that. Maybe you just have to dig down deeper than I did. And then, the last piece of, how do we do guidance on these things? So, I mean, those are my three questions that, as if you're going to go through it, to come back and get some feedback from us again, that's what I'd like to see analyzed a little further.
Okay. I'm not hearing any more discussion. So, and we do need to wrap our discussion up. So Jessica will meet with her group tomorrow and then kind of give us a summary so we know where that stands. I'll get together a packet of information, both see if I can dig through the Restore Illinois piece, and then condense down the heart of Illinois, because it's quite a lot of reading. Get the questions that we have together, and then I'll set, yeah. Are doodle polls legit for a special meeting? Susan, do you know?
You mean to figure out a time to have a
Yeah.
special meeting? Oh, yeah, you can go out, send a doodle poll first to find out when everybody's available and then pick
Okay,
a time and then call it. But you just have to make sure you post it 48 hours.
right. Yeah, that part I'm familiar with. It was the doodle poll that I was concerned about. All right, so then I'll do that. I'll send out a doodle poll to see what days work the best for everybody and what time, and then we'll go from there. Is that agreeable? All right. Corey, go ahead.
That was my consensus.
Okay, that's fine. All right. But again, you guys, what a great discussion. Thank you so much. So I'm going to move on to our action items. We have a contract for the COVID-19 crisis response. It was in your packet. Do I hear a motion? Dr. Ginsburg moves. A second. Sonia,
Second.
any
A second.
discussion? Any questions? Okay, all those in favor, do your hand wave. All opposed, same sign. Thanks, guys. Abstentions? Motion carries. It was unanimous. I don't know, Amy, if you can see what's going on or not. It's difficult. So we have an interagency agreement for a genetics program. This is a recurring program. It's not new. Do I have a motion to approve? Bob, second. Susan, any discussion or questions? We have a motion and a second. All those in favor, say aye or raise your hand. Perfect. All opposed? Any abstentions? Motion carries. We had contracts for the dentist and the 2 dental hygienists, and I do not want to massacre this gentleman's name in public. Approval. Scott, second. Corey, any discussion or any questions? All those in favor? Hand. All opposed? Same sign. Abstentions? Motion carries unanimously. And our last agenda item is the approval for $20,000 for the Center for Human Services and Bloomington High School Embedded School Project. That comes from the Behavioral Health Policy and Funding Committee. So in my other meetings, that doesn't need a second. So is there any discussion? Questions about this? Go
I was
ahead.
just gonna say, I think I see Amy Hancock on the call, if there's any insight she wanted to bring with that recommendation.
Actually, I think Hannah would probably would be able to answer that all in
Okay.
addition to Amy.
The decision to go with the District 87
Mhm.
and CHS.
Yeah, and here's Amy. But anyway, I think, what I would say is, we had both the providers have been involved in doing this work for some time and have the kind of capability it takes to deliver the services. Normal Community actually already has an embedded counselor there, whereas Bloomington High
Okay.
School does not now have one. And I think also Bloomington is in higher need category of those zip codes with the problems. So I think basically the decisions, I think, just tipped a little bit more to putting one in place in Bloomington and also the higher need. And Amy, I don't know if you want to add anything?
Yeah, sure. So it's basically what Hannah said, that the Mental Health Advisory Board members and the Behavioral Health Standing Committee members were all very pleased by how the agencies, both agencies, CHS and Chestnut, have evolved with the program over the last 3.5 years. But the decision really, from the grading matrix and from the board members' comments, the decision really came down to the school, and that there was data and evidence that they believe that Bloomington High School was in higher need of that program than normal high school.
Sounds good. Thank you.
I would just add, while that alone was relevant data to make the decision on, the other point that I think should be noted is that all of our other dollars are going to, three of the other schools are District 87, or are Unit 5 schools. And so it also seemed reasonable that District 87 might get some dollars in addition to the Unit 5 funding that we're already doing in 3 places. And then the other one, of course, is Olympia.
Thank you.
Sonia?
No, I was just saying thank you.
Oh, okay, I'm sorry. Any other discussion or questions? Thank you, Amy and Hannah. All right, we have a motion and a second. All those in favor? All those opposed? Any abstentions? Excellent work. That concludes our agenda. Before we go, I just want to thank Tammy, Tom, Kim, and Amy for bearing with us, and Kathy, Amy, Brooks, and Jessica. I don't think she quite was ready for this much notoriety when she took the job, so. But you guys are all doing a great job, and we really appreciate it. So do I have a?
Welcome to Illinois, Jessica. Welcome to Illinois.
Yeah, thank you for having this pandemic for me.
You know, you may have faced some of those same things in Farmington, but probably a little more intense here.
Oh, no, like, I am so happy to be here, trust me.
Okay, good. Well, that makes all of us happy then. We're glad you're here. That's good news.
Yeah, so happy.
We don't want to see you going back.
No, definitely not. All right, is there a motion? Is there any other comments? Is there a motion to adjourn? Susan, second. I assume you're all in favor of that. Are you guys be safe? Have a great week.